Bismillahirrahmanirrahim. My name is Prof.Dr. Latif. I am working as a professor of medicine in Akhtar Saeed Medical and Dental College, Lahore, and simultaneously I am working as a professor of medicine, practicing as a professor of medicine in Farooq Hospital, Allama Iqbal town. I have got more than 30 years of experience in general medicine, and in general medicine all medical illnesses are covered by the physician, but the most notable things are high blood pressure or hypertension, popularly known as hypertension, high blood pressure. The blood pressure may be primary or secondary. It may be stage 1 or stage 2 or stage 3, and sometimes the stage 3 blood pressure is very high blood pressure and is difficult to control, and it complicates the other organs. I can successfully manage the high blood pressure, whether it is simple or whether it is complicated blood pressure. And similarly, I have the experience of managing the diabetes mellitus, whether it is complicated diabetes mellitus or uncomplicated diabetes mellitus, with diabetes or without diabetes. And the diabetes may be type 1 or type 2. Type 1 diabetes mellitus is the one which starts in the early age of the life, and it is usually mentioned with the insulin. It is not very difficult, but the compliance on the part of the patient is mandatory. Similarly, type 2 diabetes mellitus, with or without obesity, is very easily manageable, provided the patient follows the doctor's advice. Similarly, the patients have sometimes, rather on a number of occasions, the thyroid involvement also. And in that case, the co-problems like diabetes mellitus and thyroid illnesses both can be managed simultaneously. And the popular thyroid illness with the diabetes mellitus is hypothyroidism, in which usually the weight of the patient is very high. And I can manage the diabetes mellitus simultaneously, hypothyroidism, and the weight of the patient is also manageable. And most of the time the weight of the patient is reducible also, provided it is not morbid or provided it is not congenital. The familial weight is less likely to be reduced, but mostly weight reduction is possible to be reduced most of the times. And similarly, the infectious diseases like acute diarrhea, acute hepatitis, acute pancreatitis, and chronic hepatitis like hepatitis B and C, I have been successfully managing for last 30 years. And I have seen an era of about more than 30 years in which the cases of hepatitis C and B we used to manage with interferons, and now we are managing them with the oral medications, and now the hepatitis is almost has become extinct and very few cases are reported nowadays. Similarly, the hepatitis B has been managed successfully over the last 30 years and only few cases are reported now. The pancreatic problems, pancreatic infections, both acute and chronic, are successfully managed in Farooq Hospital, Allama Iqbal town. Acute diarrhea is also possible to be managed very easily, whether it is bacterial, whether it is amoebic, or whether it is viral. People should not be much worried about, but they should report in time. But once they suffer from the dehydration, the quick reporting to the hospital and early start of the treatment is possible, and the acute diarrhea can be settled safely. And it also, Vibrio coli is the notable example in which the patient suffers from massive diarrhea and massive loss of water and electrolytes, and sometimes the life of the patient is at a risk. But if they successfully manage in time, the patient can recover easily. Similarly, the patients of dengue fever, I have seen an era of about 15 years. The dengue fever started in 2010, and since then I have been managing this viral infection very successfully over last 15 years, and mortality rate has been very low in Farooq Hospital, Allama Iqbal. Alhamdulillah. So the same way, the common GI problem including acid peptic disease, popularly known as peptic ulcers, acid reflux disease or GERD, and similarly irritable bowel syndrome, they are also very easily manageable provided the compliance of the patient is good. I convey my message to the people of Allama Iqbal town and all those people who are listening me that whosoever suffers from the diseases which I have mentioned earlier in this interview, you can contact Farooq Hospital reception, and according to your desire you can come for treatment. Inshallah, you will certainly get the benefits from this hospital. Thank you very much for patiently hearing me. Professor Dr. Muhammad Latif, Farooq Hospital, Allama Iqbal. Goodbye.